Today, we're talking about a drug that's made a pretty amazing comeback. It's called Hydralazine, and its story is all about how an old-school medicine found a new life-saving purpose.
So, right off the bat, here's the big question. This drug, hydralazine, it's not the first thing doctors reach for anymore to treat high blood pressure. But for some people, it is an absolute lifesaver. So how can that be? How can it be both kind of old news and totally essential? That's what we're going to dig into.
Okay, so first up, let's talk about Hydralazine's journey. You see, it used to be a go-to frontline therapy, but now it's more like a specialized tool pulled out for some really specific, high-stakes moments.
Yeah, there are newer drugs out there now, ones with fewer side effects, and they've pretty much taken over for the day-to-day stuff. But hydralazine has this unique power that makes it absolutely indispensable when things get critical. It didn't just fade away. It found its perfect, life-saving sweet spot.
So, what's its secret? How does it actually work? Well, its main mission is simple but incredibly powerful. It widens arteries. Let's dive into its direct-acting mechanism, because this is what really sets it apart from a lot of other blood pressure meds.
All right, the magic word here is vasodilation. It's just a fancy term for relaxing and widening your blood vessels. Now, hydralazine is a direct-acting vasodilator. And that direct-acting part is super important. It means it doesn't mess around with middlemen. It goes straight to the source, right to the smooth muscle in your artery walls, and basically tells it, hey, chill out, relax.
Okay, so how does it pull that off? It's actually a really clever four-step chain reaction. First, hydralazine helps create nitric oxide, and that acts like a key, opening up potassium channels in the artery walls. Step 2, potassium ions start flowing out of the muscle cells. Now this is where it gets cool. That outflow of potassium slams the door shut on the calcium channels. And why does that matter? Well, calcium is the go signal for muscles to contract. So by blocking calcium from getting in, the muscle just can't tighten up. It has no choice but to relax. The artery widens, and suddenly, blood can flow way more easily.
And the end result of all that? It's huge. When all those little arteries chill out, the overall pressure in your whole circulatory system just drops. Think about it. Your heart doesn't have to work nearly as hard to pump blood through what were once tight, narrow pipes. Its workload goes way down, and you get a really significant drop in blood pressure. Simple as that.
Okay, so we know it's powerful, but where is it used today? Where does it really get to be the hero? Let's take a look at its modern, life-saving niche. It really shines in three key situations. First, there's something called resistant hypertension. This is when someone's blood pressure just stubbornly stays high, even when they're on a bunch of other medications. Second, it's a safe and effective choice for managing really high blood pressure during pregnancy. But its biggest, most important role today, the one we're really going to focus on, is in treating heart failure.
Now, when it comes to heart failure, hydralazine almost never works alone. It's part of a power duo, usually paired with a nitrate called isosorbide dinitrate, and together they are just an amazing team. See, hydralazine focuses on the arteries. It lowers the pressure the heart has to pump against. Doctors call this afterload. At the same time, the nitrate works on the veins. It reduces how much blood comes rushing back to the heart. That's the preload. So you've got one drug helping blood get out and the other easing up on the blood coming in. They're tackling the problem from both ends to give that struggling heart a serious break.
And we're not talking about small improvements here. The results are incredible. This combo dramatically improves, well, pretty much everything. Symptoms get better, quality of life goes up, and most importantly, people live longer. This was shown really clearly in a major study called the AHEF trial, which found huge benefits, especially for African American patients with heart failure.
Okay, but a drug this powerful has to have some downsides, right? Of course, it has side effects. But what's so interesting about hydralazine is that the side effects aren't random. They make perfect sense. They're the direct, logical result of its main job, powerful vasodilation.
It's a really clear cause and effect situation. So your body feels that sudden drop in blood pressure, and what does it do? It freaks out a little and tells the heart to beat faster to compensate. That's tachycardia. To counter that, doctors will often prescribe a beta blocker to keep things calm. Same thing with fluid retention. Your kidneys sense the lower pressure and think, oh no, we need to hold on to salt and water. The solution? A diuretic. Even headaches and dizziness. That's just the blood vessels in your brain widening. See? It all comes back to that one main action.
Now, there is one more serious side effect we have to talk about, even though it's pretty rare. It's called drug-induced lupus.
It's an autoimmune type reaction that can show up as joint pain or a rash. But here are the key things to know. It doesn't happen often. It's more likely if you're on a high dose for a long time. And, this is the most important part, it almost always goes away completely once you stop taking the drug.
All right, so all of this brings us to our final piece of the puzzle, the practical stuff. How do doctors use this drug safely and effectively? Well, it all comes down to paying close attention to a person's genetics, their other health issues, and getting the dose just right.
To really get why dosing is so tricky, you need to know about a process called acetylation. It sounds complicated, but it's just the word for how your liver breaks down hydralazine and gets it out of your system. And the wild part is, how fast your body does this is hardwired into your DNA.
Yeah, it turns out the population is split pretty much down the middle, about 50-50. You're either a slow acetylator or a fast acetylator. If you're a slow one, the drug hangs around in your system longer and at higher levels, which means you've got a greater risk of side effects. But if you're a fast acetylator, your body clears it out so quickly that you might actually need a bigger dose to get the job done. It's like a genetic lottery, and it's a huge reason why a doctor has to tailor the dose so carefully to each person.
And finally, it's not the right drug for everyone. Patient selection is absolutely critical. Remember that fast heartbeat reflex we talked about? Well, that can put way too much strain on a heart that's already struggling. So doctors are extremely cautious about using it in people with coronary artery disease. Also, since your kidneys help clear the drug, the dose has to be tweaked carefully for anyone with kidney problems to make sure it doesn't build up to dangerous levels.
So when you look at the whole picture, the story of hydralazine is really a great lesson. It shows how a drug's purpose can totally change over time. It's not the go-to choice anymore for most people. But for the right patient in the right situation, it is an absolutely vital, life-saving tool. It's the perfect example of how in medicine, old definitely doesn't mean useless. And that kind of leaves us with one last question to think about, doesn't it? We're always looking for the next big thing, the newest discovery, but Hydralazine's story makes you wonder, what other old drugs are sitting on the shelf right now, just waiting for their moment, waiting for us to figure out their hidden potential so they can make their own incredible comeback?